I'm unbridled, I'm unfiltered, appraisal and sale. I got something to say right now.
Yeah, you've come to the right place. Will this pandemic impact value now?
There's so many moving parts and moving around on me that associates are going to be abundant, lower commission rates when they come back.
What do you say to the young doctor today?
You're going to be underemployed or unemployed for the next 3, 6, or 9 months as an associate dentist.
I actually had a beer earlier today, but when I knew I was coming out with Tim Brown, is now a good time for people to be looking at selling?
But what's it worth today? Like an N95 mask, scarcity.
Feeling the same pain, your doors are closed, there's no production. Across your mind, the thought of selling. I know you're probably texting Tim right now going,
because Canadians have a very high dental IQ. You've taught us well. Way to go, dentists of Canada. We heard you. We show up because we value.
This teledentistry.
I'm gonna get my little robot arms through the computer, like.
Pour me a vodka.
Set up a little bar over there.
I love it.
I love it. Welcome back to UP Dental Academy. This is Leadership in Times of Crisis. I'm here as always with Dr. Agatha Biss, and honored today to have Tim Brown from Roy Corp join us to give his insight and his thoughts as a thought leader in the dental industry on where we're at right now. I'm looking forward to an inspired and exciting conversation with Tim and Agatha today. Tim, welcome on board.
Thanks, Mark, and thank you, Agatha. Most of you would know that, my dad, Roy Brown, started this company in 1974. So in the last 46 years, we've appraised about 10,000 dental practices. We've sold thousands of them. We're an appraiser and a broker. Our primary core competency is helping a dentist to know his or her dental practice for many reasons. People need to know for insurance purposes, matrimonial reasons, partnership formations, dissolutions, buying, selling. Appraisals are done for many reasons. Now, in this particular time, our appraisal business is operating full-time because people still need to know the value. Most of our clients have decided it's probably a good time to get a February 29, 2020 value put on the practice, just so we have some benchmark to measure whatever happens next.
Right.
In our discussion, we'll talk a little bit about what's going to happen next. That's who we are. That's what we do.
And like I said, we're grateful that you're here today. And Agatha, welcome back, as always. Tim, the first thing I wanted to jump in on is right now, I know there's probably a lot of fear in our industry, and you're seeing it every day. I'm sure you're fielding calls. Is now a good time for people to be looking at selling? Because every dentist I've talked to, they're on that fence of right now, what do I do? Am I at that transition age, or am I in a tough space in my dental career with everything that's going on? Is now a good time to be thinking about selling?
Well, for the practice owners out there, the biggest risk that you take right now is what's it worth today versus what will it be worth in 1 year, 2 years, and that's forward projection making valuations, and we don't know yet. Until time passes and until I know the recovery rate of your practice and how it measures up in 1 to 2 years compared to 2019, I don't know. And that's a gamble we're all taking. We're talking about consumer behavior here and the propensity of Canadians to return in a trustworthy and predictable fashion to continuing care for dental offices. And there are so many predictions on that. I'm not going to make any. You've all got your own, folks.
Yeah.
If your patients return and if your practice recovers, now we have to look at the supply, demand, and free flow of low-cost capital equation. So post-COVID reopening revenue, wait and see. The gamble you're taking is that if your practice doesn't recover that well, it's probably going to be worth less. But what's it worth today? And my opening dissertation, I want to be part of something that is unbridled, unfiltered. Don't ever use the word.
You've come to the right place.
I am unbridled. I am unfiltered. In the one little wheelhouse, the little silver sliver of a lane of the economy for dentists that I work in, which is appraisal and sale. That's my wheelhouse. That's my core competency. That's my lane. I'm not going out of it. I got something to say right now. There's so many moving parts moving so fast right now that everything I said a month ago is different today, and it's going to be different 30 days from now. And I'll preface everything I say with, this is what I think right now. But I know with all of the moving parts of this puzzle, and they keep moving around on me, this is what I think today. And I can answer every one of those questions today. Third point, I want to talk about my prediction for the great transfer of talent. And this is the massive resignation of people that do not want to return to dental practice ever. And we
Right.
don't know how many that are yet, how many that is yet, because they're all sitting at home collecting some sort of support from somebody. So you don't resign today. Only a fool would resign from their job today.
100%.
But what's going to happen in 30 days when Agatha, you call your staff, you might find that someone says, Dr. Biss, I'm so sorry. I don't want to come back to work. I'm going to go work at a veterinary practice. Dental office freaks me out. I want to get pregnant. You know, I don't want to come back to work. That's going to happen. We don't know how many. And where that's going to happen the most, guys, corporate dentistry. Everybody should stop assuming all your staff are sitting there just desperately waiting to come back to dental practice.
I agree.
I don't think that's the case. We'll see. Second thing is that associates are going to be abundant because they're not going to be busy. They are probably all going to be offered lower commission rates when they come back because overhead just went up. I don't know how much. I'll calculate that later, but it's going up.
Yeah.
That we know.
Yep.
That's a fact. How much? Don't know yet. Give me 6 months. Give me a year. We'll all look at the numbers then and we'll all figure it out. So who's going to pay for that? Insurance companies might offer a little extra sterilization protocol fee.
I don't think they
Maybe
will,
maybe
actually.
not. So even if they throw in an extra code for, you know, $8 per patient for some sort of operatory turnaround, prep, disposable gown fee, really that's got to come from somewhere. You can only get so much out of the patient. You're only going to get so much out of insurance. There's your revenue equation. Fewer people will probably come to the dentist in the short term, so revenue is lower. Where's the money going to come from?
Yeah, the cost of business is going through the roof.
Go ahead and offer your staff $2 or $3 an hour less, see where that goes. So the owner has to make less, so the associate has to make less. End of equation. Because landlords aren't going to give you any break. They'll give you a delay, they're not going to give you a reduction. The bank might give you a delay on your loan, you still got to pay it back with interest.
Yeah. Yeah, we're coming back to a lot more debt than we came into.
I'm taking a pay cut, you're taking a pay cut, Dr. Associate. End of discussion.
Yeah,
So
agreed.
that's really going to complicate the relationships between principal and associates, but principals are going to have to take a stand on this because the days of 40% associates are done. They were done 5 years ago. They've all been overpaid, in my opinion. But
Well, I don't understand how you can even do that with
Because-
overhead the way it is.
it's just lazy owners didn't fight back. I've been advocating for years with my clients that, hey, say 30% on the first 10 or 20 grand, 35% on the next 10 or 20, that'll take you up to 40.
You know, I was talking to some dentists and we were just sort of all talking about the challenges of seeing emergencies. I mean, if we do see an emergency, but we can't use a high speed, we can't use this, we can't use that. I mean, you're not really helping anybody by seeing them. So, you know, can I do
You
something?
could accidentally perform professional misconduct because of the lack of the equipment you can use.
Yeah. And
So
so
write a script. That's all everybody's doing. Cover your ass, write a prescription, send them home, right? Better than nothing. And you can do that by teledentistry, of course. But
What am I gonna get my little robot arms through the computer? Like how is like
and there's 3 pillars that are driving this market right now in April 2020. Scarcity of supply. There's not a lot of good practices for sale. There never was for the last 3 to 5 years. There's certainly not many right now.
how do you define a good practice?
You know, I think the average good practice today is one that has general dentistry procedures, restorative around 40 to 50% of production, preventive billings in the 30 to 40% of production, nice diagnostic revenue. Most buyers today don't want practices that are doing more than 5% in any of the disciplines that are non-general dentistry. They get a little intimidated when they see a lot of endo, a lot of ortho. Good leases, premise leases are really, really important when selling practices today. If you don't have 2 or 3 renewal options in your lease, get them. Employment contracts, you know, regardless of who your employees are and what they look like in the future, if you don't have proper written employment contracts today, your practice is worth less than the identical one that does have proper written employment contracts. If you don't have them, get them. If you don't know where to get them, you've got 3 experts in front of you right now who can send you there. Don't be stupid, doctor. Implement proper written employment contracts and review your premise lease. And the rest of the statistics and the highlights, there's only 3 or 4 top ones. I just covered them all. Your premise lease, your employee contracts, associate agreements, if you have them, they should be in writing, folks. So, you know, there's where a good practice lands, but there's not a lot of them out there. So of those 3 things, Agatha and Mark, there's not a lot of good practices. So scarcity of supply. Like an N95 mask, scarcity. Item
Let's see what
two,
Trump says about that.
yeah. So the second pillar of my theory is demand. We have a lot of buyers in Canada. We've had them for years. There are thousands of people looking to buy for the last number of years. The corporates are still looking to buy. And then the one thing a lot of people forgot about really stimulated demand practices lately are the thousands of dental associates that are sitting at home right now. And they are predicting that when practices reopen, they're going to be the last ones to go back to work. And there's many reasons for that. And most of us know that owners feed their families first.
Right.
So because these associates are so worried about job security, they're so worried about job security and they're so worried about what their future looks like, what we're seeing is that they have two choices: set up a brand new practice or buy a practice. Is setting up a brand new practice in a major city of Canada a good decision in the fall of 2020? I don't think so. There's enough competition already.
Right.
So buying a practice is one of the last choices that the associate dentist has. So the number of people looking to buy practices just skyrocketed in the last 30 days. Skyrocketed. And I can easily measure that by views to our website, because all our website analytics show the number of inquiries, frequency, the volume, the number, the new subscribers to our service, which is voluntary. If you want to know what's for sale, folks, you can voluntarily subscribe to Roy and the other brokers. They have a similar service. So scarcity went, the supply went way down, demand went way up, and interest rates plummeted. I predict a lot of practices will be worth less because of the patient behavior and recovery rate of people returning to the dental office. Some of you are going to do better a year from now. Some of you will do worse.
I think I will.
Measure it.
I think some of us will, because this is forcing some of us to restructure what we're doing. We've gotten so fat in a way, kind of gotten used to doing things a certain way without really thinking about, the impact, that now that we've got time to sit around and kind of go, what am I going to do differently that I sort of thought about doing, but I never really had the time to do. Now I've got time. So now I'm actually implementing changes that I've sort of thought about, but really didn't focus on.
One of the fundamental pillars of business valuation is earnings. And if we don't have earnings, we don't have a business to value. There's a few exceptions to that, such as a brand new turnkey office. But when earnings go up, business valuation goes up. When earnings go down, business valuation goes down. I think it's pretty safe to conclude that the 2020 earnings of all Canadian dental practices will be lower than 19. That's going to be a historical filed fact come December 31 this year. That generally suggests lower valuations. But some businesses and some owners are very carefully calculating right now about how can I reopen and not only manage my new requirements for spending, protective equipment, air handling, whatever the new costs are, what other overheads can I look at to possibly reduce my operating costs? So that I can remain my earnings level and maintain my business value. And I'm sorry to say this for the non-owners on the call, but it's the associates that are going to share in the pain with the owners because staff can't share in it. All of their rights and entitlement and seniority remain intact. Even though we just issued records of employment and technically we've terminated or laid a lot of people off, they're all going to be able to return at their previous wage levels. Other words, you get into constructive dismissal, folks. Don't try to reorganize your staff. Be very careful about that.
Tim, can I just jump in? Just a quick question on the reorg. On the reorg, you're talking from a pay scale structure. You can't all of a sudden come and say, "Our production is this. You were making X, and I can only afford to pay you this certain number." Does that go into effect with everybody, or just people with employment contract?
So,
from what you know.
Okay, I'm not a labor lawyer, and I don't want to become one, but Employment Standards Act is very simple. This record of employment issuing and this temporary measure is not going to be considered a fresh start for all employers. You can't just start rehiring 20-year people as though it's a brand new job. So seniority and accumulated benefits is likely to be very firmly entrenched. The practical side of this is if you've only got 50% of the hygiene book that you had when you closed, why would you pay someone 100% hygienist to return? I don't have the patience. I don't have the hours. So I can cut your hours to meet my future demand, but I probably can't cut your rate of pay.
That's right. And that's one of the things we were talking about with Jonathan Borelli, the employment lawyer, and we're going to do a call-in show as well. And he's also supporting that we can bring people back part-time or, reduced hours depending on the need. So that is an option for a lot of dentists.
Yeah, but so consult with an employment lawyer. Jonathan was on this call. There's a multitude of them out there. If you don't know where to find them, we do on this video. But be very careful about that. But you have to get your overhead lower. And if the owners are going to make a little less in 2020, who should share in that? The next and most logical place to go is your associates if you have them. And 40% pay to associates, that's done now. I just don't think that doesn't work anymore. So I'm sorry, associates, but you're probably going to get a pay cut and you might not even be asked back to work. And if you are asked to return to work, it could be very, very part-time for a very long time.
Long time, yeah.
That's why they're all trying to buy practices right now. That just makes sense.
So, Tim, as a thought leader in the industry, you've got banks calling you, asking for your opinion. You obviously have countless doctors reaching out to you. What do you say to the young doctor today that's maybe looking to become an associate or looking to buy? Is this an opportune time for them? What's the advice you're giving to the young doctors entering the dental industry?
So for anybody that's not an owner right now and has a license to practice in Canada, you're going to be underemployed or unemployed for the next 3, 6, or 9 months as an associate dentist. Not all of you will, but the majority will, because owners will feed their families first. I don't think I need to expand on that. Secondly, setting up a brand new practice in Canada, signing a lease right now, and opening in the summer or fall of 2020 is probably not a good decision. And if you haven't already spoken to your accountant or banker about that, talk to them. I think they'll tell you what they think. So it really just leaves the stay at home and not do anything or buy a practice if I have to. People are buying practices today knowing that it'll take them 12 years to pay back the loan instead of 8. They're buying practices saying, I'll make less. I might not even make as much as an associate, but at least I'm an owner. And now I have career control. I'm young. I've got time. Ownership, Agatha, you're an owner, and all of us have spoken to a lot of other owners lately. It's not fun to be an owner of a closed practice, but at least you can go back to practice day one and work as hard as you choose to work. Associates do not have that choice right now, do they?
No, because you're right. I mean, I have a lot of options depending on how many patients are coming back and how they're coming back. I can always change the way I work,
whatever you want. You're the owner.
Yeah. And I'll make it happen because it's mine. Whereas when I'm working for someone else, I'm dependent on what they tell me to do and when they tell me to do it. So, yeah.
So I'd rather be an owner of a closed practice than an unemployed associate.
Yeah. What's the message you want to give to our community?
Listen, closing your practice at a time like this, which is completely out of control, is much like having a flood. Many, many dental practices over the years have suffered from floods. It's a common phenomenon because of all the waterworks in your business.
I had one. Yeah.
You close, it's 30 to 60 days until you can reopen. It appears like a disaster. You clean it up, you get the water out, you fix everything up, insurance pays for it, and you go back to work. Yeah, you're not fully insured this time around, but let's ignore that just for a minute. Your patients are waiting for you. But when one practice closes for a flood, those patients have someplace else to go. Every practice in Canada is closed for a flood right now. Just think about that for a minute. So you're all equal. Everybody's closed. The patients have nowhere else to go. Hopefully you've had some patient communications going. Everybody's talking about that in social media. Don't leave them hanging. And when you reopen, you'll find out just how many loyal returning patients you have. And it should be the majority for most of you. It should be the large majority for most of you, because Canadians have a very high dental IQ. We have a very strong and powerful propensity to return for regular dental cleaning because you've taught us well. Way to go, dentists of Canada. We heard you. We show up because we value our oral care. And remember, 35% of Canadians don't go to the dentist on a regular basis anyway, so you still have an untapped market you haven't even touched yet. Spend a little time on them, never mind the patients you already have. The final thing I would say on patients is stop worrying about new patients. Worry about the ones you've already got. Spend your time and energy on the patients you already have. Advertising and marketing and social media and all of that stuff, sure it's there and sure you have to. Spend a little time and money on the patients that are loyal to you. Loyalty deserves to be rewarded right now. 100%. When I go to my TELUS and I see that a new customer can get a free phone and I got to pay $1,200 to fix my friggin' broken iPhone, I'm pissed off. Why did that guy get a free electric brush when I've been coming here for 20 years? Watch that. Watch that. I just want to say, so there's just my overall. You're going to be fine. Go to work, show up early, work through lunch, do what you did when you were a kid, you'll be fine. Do what you did when you were a kid, you'll be fine. I want to say one thing. So in my book, because you just touched upon bonuses, because this is the perfect time, to change your bonus system, whatever it was. Page 77.
And I quote,
bonuses should not be set or paid at allocated times, which means random. Bonuses should be immeasurable to your staff. Random and immeasurable. And the example I give of that is, have you ever had anyone just bring you flowers out of the blue for no reason? Those are the best flowers to get. Stop with all the calculations. Stop with all the formulas. Stop with all the performance targets. Stop with collections and new patients. And every measurement you have in your bonus system will keep you awake at night and give your staff license to find a way to make those metrics happen so they get their bonus. Stop it. Happy to expand with anybody. Happy to give away 10 free copies of this book to those watching. Just send Agatha, Mark, or I an email, and I'll send you a free copy of my book.
Add all the contacts.
Well, there'll be 9 free because I want one. So there we go. I gotta buy one.
Away from your viewers.
I hope that helps, and I really thank you guys for letting me have an audience. And I appreciate you sharing this with those that are, part of your circulation. Everybody just needs to wait for the opening, get open, and go back to work, and then we'll see what happens from a valuation and sale perspective.
It's interesting that you mentioned that thing about paying attention to your own clients versus, on what's out there. There's a webinar I was listening to, and they were talking about, some dentists who have really optimized their, whether it's social media or whatever marketing they do, and they're getting 100 new clients a month. And I'm just thinking, how do you even accommodate 100 new clients well? I mean, you can't, because you're either whipping them through, or you have so many leaving your practice that you have all these openings. So, I mean, I have about, I'd say 1,000 active patients. Now, what I consider active are people that have been in my office in the past 12 months. So I don't look at 24 like a lot of people. I look at the last year. Who's ever contributed to my business is an active patient. Anyone else isn't. And I mean, my practice is busy. I mean, I have 5 hygienists on 1,000 patients. So we can accommodate 100 more a month. I mean, that would double my practice, more than that, in a year.
Chaos. It's drive-through dentistry, drive-by dentistry, and drive-through dentistry. Some practices have a very high attrition rate because they're churning and burning their patients too quickly. You're treatment planning too aggressively. You're frightening people away. You're not giving them a wow experience that they want to stay with the business. So many practices are losing more than they're gaining, but they can't measure the loss. You can only measure the gain. A lot of patients don't call you up to say, I'm not coming back. They just don't come back.
They don't come back. Definitely, we appreciate the fact that you're going to offer your book out. So if you're watching and you want a copy of Tim's book, send one of us DM. There we go. Check that out. And we'll make sure that you get it. And I think Tim will actually even sign it for you for the first 10 people.
Yes, and I put my cell phone number in there so you can call or text if it's urgent. I'm always available.
Fantastic.
Thank you so much.
Agatha, thank you as always. And Tim, we really appreciate the fact you've taken this time out of your day to share with us. And we look forward to doing a live webinar.
I'm at the cottage on the lake. Let's book a live webinar. Thanks for watching, folks. Stay safe.
Thanks.
I'm right back to 2008 where I want to get out.
No, you don't. I'm gonna say I actually had a beard earlier today, but when I knew I was coming on with Tim Brown, I shaved it into a goatee. And come up and pour me a vodka.
Would you like a vodka?
I'd love a vodka.
I've set up a little bar over there.
I love it.
I love it.